There is a pattern that has appeared in health research over and over again, and it involves something millions of people over 60 do every single morning, often within the first 30 minutes of waking up. They reach for a vitamin B12 supplement, swallow it, and believe the job is done. This is not new information in medical circles. Physicians and nutritional researchers have understood for years that the way most older adults are taking B12, the timing, the form, and the conditions surrounding it, means their bodies may be absorbing far less than they think. The consequence is not abstract. Your nervous system depends on this vitamin to maintain the protective coating around its fibres. Your brain uses it to regulate the very chemistry of memory and mood. Your blood cells need it to form correctly and carry oxygen to every organ in your body. Left unaddressed, the gap between what you are taking and what your body is actually using grows quietly wider over time. I am Dr. Stephen Cladwell, and this investigation is going to trace that gap from its root, through the biology, through the overlooked variables, and all the way to a precise, evidence-based plan for what to change. The next time you reach for your B12, you will know exactly what to do differently. Let us begin. So let us look at where this actually begins, because understanding the scale of the problem is the first piece of evidence in this investigation. It is estimated that up to 20% of people over the age of 60 become deficient in vitamin B12, a statistic that sits quietly in medical literature, while tens of millions of older adults continue their daily supplement routines without knowing whether those supplements are actually working. Think about what you do each morning. Perhaps you take your B12 with a glass of water. Perhaps you take it alongside your other supplements, or with a full breakfast, or after your first cup of coffee. It feels like the right thing to do. It looks correct. It is consistent. And yet, for a significant portion of the people doing exactly this, the vitamin is not being absorbed at anything close to the level they expect. Vitamin B12 deficiency is common in older people and is linked to anemia, cognitive decline, and dementia. That connection between something as fixable as a supplement routine and something as serious as cognitive decline is precisely why this conversation deserves careful attention. Vitamin B12 deficiency is often missed because the symptoms, fatigue, anemia, neuropathy, memory problems, or walking difficulties, are quite common in older adults and can easily be caused by something else. Also, vitamin B12 deficiency tends to come on very slowly, so people often go through a long period of being mildly deficient. During this time, an older person might have barely noticeable symptoms, or the symptoms might be attributed to another chronic health condition. That is a significant and sobering reality. The very symptoms that should prompt investigation are the same ones that get explained away as normal aging. The fatigue blamed on a long week, the memory slip dismissed as just one of those things, the tingling in the hands attributed to sleeping in the wrong position. Picture your nervous system right now, not as a fixed structure, but as a living network of fibres, each one wrapped in a protective sheath called myelin, the way an electrical wire is wrapped in insulation. Once absorbed, B12 is used as a cofactor for enzymes that are involved in the synthesis of fatty acids and myelin. Without adequate B12 reaching your cells, that myelin sheath begins to degrade. Nerve signals slow, sensation becomes unreliable, coordination falters, and these changes are not immediately obvious. They accumulate across months and years, long before a clinical test catches them. A mild deficiency will almost always get worse over time. That single sentence is the quiet alarm this investigation is built around. But this is only the surface layer. What the research shows underneath it is far more significant. To understand why this matters more than most people know, we need to go deeper into the specific biology that changes after age 60 and why it changes the entire equation for how B12 must be taken. Think about what you had for breakfast this morning. Eggs, perhaps, a piece of meat, some dairy. These are the primary food sources of vitamin B12, and for most of your life, your body was reasonably capable of extracting the vitamin from those foods through a precise digestive process. But that process is not static. It is one of the physiological systems most directly affected by aging, and most directly overlooked in standard supplement advice. Vitamin B12 absorption is a highly complex process that often becomes less efficient with age and involves the stomach, pancreas, and small intestine. Each of those organs plays a specific, irreplaceable role in the absorption chain, and when any one of them begins to function with less precision, the entire chain is compromised. In the stomach, secreted gastric acid and pepsin are essential to liberate vitamin B12 from the proteins in food that bind it tightly. That liberation step, the freeing of B12 from the food it arrives in, is the gateway through which everything else must pass. Older people are more likely to get vitamin B12 deficiencies because it is absorbed from food by stomach acid. As you age, however, your stomach acid starts to decline. This is not a marginal change, because up to 30% of adults over 51 years of age have atrophic gastritis with low stomach acid excretion. It is recommended that they meet the RDA for vitamin B12 with supplements and/or fortified foods. 3 in 10 adults in this age group. That is not a rare condition. That is a standard feature of aging that the medical community has tracked for decades. Yet most people sitting across from their doctors on routine visits have never had it mentioned in the context of their supplement routine. Normal function of the digestive system required for food-bound vitamin B12 absorption is commonly impaired in individuals over 60 years of age, placing them at risk for vitamin B12 deficiency. The next piece of this investigation is the one most people never reach. Stay with me. When researchers dug into this further, what they found was unexpected in its specificity. A second layer of the absorption problem that sits beneath the stomach acid issue and compounds it significantly. Remember what I just described about gastric acid freeing B12 from food? That is only step 1. Once liberated from food, vitamin B12 is bound in the stomach by R proteins, which carry the vitamin to the intestine. The R proteins are degraded in the small intestine by proteases secreted from the pancreas, thereby liberating the vitamin B12. The vitamin B12 does not remain free in the intestine, but rather binds to another carrier protein called intrinsic factor, which is secreted by the parietal cells in the stomach. Intrinsic factor. That phrase is at the center of this entire investigation, and it is almost entirely absent from the conversation most people have with themselves when they purchase a B12 supplement at the pharmacy. Another key factor is less intrinsic factor production. Intrinsic factor is a stomach protein that helps the body absorb B12. With age, the cells that make intrinsic factor work less well, making B12 absorption even harder. Now consider what this means in practical terms. You swallow your B12 supplement each morning. It arrives in a stomach where acid levels are lower than they were 20 years ago. It encounters a supply of intrinsic factor that is reduced compared to what your body once produced. The conditions for full absorption are compromised, and most of this happens entirely below the level of conscious awareness, while you go about your morning as usual. Now add one more variable, one that affects an enormous proportion of the senior population specifically. Proton pump inhibitors, which include omeprazole, lansoprazole, rabeprazole, pantoprazole, and esomeprazole, block the secretion of gastric acid and pepsin, and therefore may be more likely to impair vitamin B12 absorption because they can induce the complete absence of gastric acid secretion. And critically, metformin, an anti-hyperglycemic agent used as first-line treatment for prediabetes and diabetes, might reduce the absorption of vitamin B12 and significantly reduce serum vitamin B12 concentrations. Think about how many people over 60 take a PPI for acid reflux or metformin for blood sugar management. These are among the most commonly prescribed medications in this age group, and both of them interact directly with the very pathway through which B12 is absorbed, and that finding changes how we need to look at everything that follows. What the data shows when you step back from individual cases and look at population-level outcomes is consistent enough that even conservative medical institutions have taken clear note of it. Approximately 21% of adults older than 60 had abnormal levels of at least one vitamin B12 biomarker. That is not a rounding error in the data. That is 1 in 5 older adults walking through daily life with a measurably compromised B12 status, often without a diagnosis, often without symptoms obvious enough to prompt a test, and often with a supplement bottle on the kitchen counter that they believe is solving the problem. Now here is the piece of evidence that is most worth examining carefully in this investigation. If vitamin B12 is added to fortified foods and dietary supplements, it is already in free form and therefore does not require the separation step. This is a critical distinction. The B12 in your supplement is not protein-bound the way B12 in food is. It does not need stomach acid to free it before absorption can begin. That means the stomach acid decline we discussed. The central biological challenge of aging in this context is actually less of a barrier for supplemental B12 than it is for food-based B12. These medicinal agents do not block the absorption of vitamin B12 from supplements because supplemental vitamin B12 is not usually protein-bound. This is significant. It means the supplement route, taken correctly, has a meaningful physiological advantage over relying solely on food sources for this age group. However, the how of supplementation still matters enormously. It is estimated that your body only absorbs 10 mg of a 500 mg B12 supplement. The absorption rate of standard oral B12 tablets, even in free form, is limited by the saturation capacity of the intrinsic factor pathway. The body can only process so much through its primary absorption route at any given time, which is exactly why the form, the timing, and the dose all belong in this conversation together. And that single data point, the gap between what is swallowed and what is absorbed, changes how we need to look at everything that follows. Here is what changes when you start making this shift. Beginning today, beginning with the very next time you reach for your B12. The first and most foundational question this investigation surfaces is the question of timing. While seniors may certainly take B vitamins in the afternoon, taking them in the morning offers more benefits beyond optimal energy production and metabolism. Consuming vitamin B in the morning helps seniors manage their natural circadian rhythm. Morning is not simply a convenience. It is a biological alignment. B vitamins like B12 and B6 have mild stimulant effects that can disrupt sleep schedules if taken in the afternoon or later. This is an overlooked variable that affects a meaningful number of people who report poor sleep quality while taking their B12 with dinner or in the evening. Simply moving the supplement to the morning, particularly before or with the first meal of the day, removes that disruption entirely. The second question this investigation surfaces is the question of form. The two most commonly available forms of B12 in supplements are cyanocobalamin and methylcobalamin. Active forms are adenosylcobalamin and methylcobalamin. Supplemental forms are hydroxycobalamin and cyanocobalamin, which are precursors to the active forms. For most healthy adults, the body can convert cyanocobalamin to its active form without difficulty. However, for seniors, and particularly for those with certain genetic variants, methylcobalamin may offer a more direct route to biological availability. This is worth discussing with your physician at your next visit, especially if you have been taking cyanocobalamin for years with no improvement in energy or cognitive sharpness. The third question is about delivery mechanism, and this is where the investigation arrives at something genuinely practical. A healthcare provider may recommend sublingual, meaning under the tongue, doses of the vitamin or B12 skin patches. Sublingual B12 dissolves under the tongue and is absorbed directly through the mucous membranes into the bloodstream, bypassing the stomach and the intrinsic factor pathway entirely. For people with significant absorption challenges, those on PPIs, those with atrophic gastritis, those taking metformin, sublingual delivery may represent a meaningful improvement in actual uptake. I want to know something. If you have been taking your B12 for months or years without ever questioning whether it was actually working, type the word investigating in the comments right now, because the number of people who respond is going to tell us both something important about how widespread this really is. The next piece of this action plan is where the sustained week-by-week strategy becomes clear. The second half of your action plan builds on everything the first half established, and it moves the investigation from acute adjustment to durable long-term protection. The first step in this half concerns dosage, because the standard recommended daily allowance of 2.4 micrograms designed for general adults does not account for the dramatically reduced absorption efficiency documented in people over 60. For those over 65, doses of 500 micrograms to 1,000 micrograms daily are often suggested to keep B12 levels right. This is a meaningful gap from the standard recommendation, and it exists precisely because researchers understand that a body absorbing a fraction of what it swallows requires a proportionally higher input to meet its actual needs. High-dose oral vitamin B12 supplements of 1,000 to 2,000 micrograms per day have been shown to raise levels because high doses can usually compensate for the body's poor absorption. The second step concerns food, specifically the foods that have carried B12 through human nutrition for generations. Think about the meals your parents and grandparents built their days around: liver, red meat, eggs, sardines. These were not incidental choices. In its natural form, B12 is found in animal-based products. It is most abundant in liver and is present in significant amounts in red meat, shellfish, fish, and turkey. Eggs, chicken, and dairy products also provide B12, but in smaller amounts. Reintegrating these foods into regular meals, even if not exclusively relying on them for B12, creates a dietary foundation that supplements can build on rather than entirely replace. The third step is the one most people avoid: the blood test. When you are in your 60s, you should officially start getting blood tests to test for vitamin B12 deficiency. A serum B12 test is simple, inexpensive, and tells you something that no supplement label or health article can tell you: what your actual status is right now. Diagnosis of vitamin B12 deficiency is typically based on measurement of serum vitamin B12 levels. However, about 50% of patients with subclinical disease have normal B12 levels. A more sensitive method of screening for vitamin B12 deficiency is measurement of serum methylmalonic acid and homocysteine levels, which are increased early in vitamin B12 deficiency. Ask your doctor specifically about methylmalonic acid, not just the standard B12 level, if you want the most accurate picture of where you stand. That conversation, initiated by you, based on what you now know from this investigation, could be the most important appointment level change you make this year. What this investigation has shown is this: the question of vitamin B12 was never simply about whether you were taking it. It was always about whether your body, or at this specific stage of life, with its specific biological changes, was actually absorbing it in amounts that make a real difference. Although common, vitamin B12 deficiency is often under-recognized, with diagnosis usually occurring on incidental blood test screening. That phrase, incidental blood test screening, means that most people only discover their deficiency when a doctor happens to check it during a routine visit for something else entirely. This investigation was built to change that dynamic. You now know that elderly individuals are often achlorhydric due to reduced parietal cell function in the stomach, increasing their risk of vitamin B12 deficiency, and the ability to absorb vitamin B12 declines with age, particularly in individuals over 60. You know that the medications most commonly prescribed to this age group can directly interfere with the same absorption pathway your B12 supplement depends on. You know that timing matters, that form matters, that delivery mechanism matters, and that the dose appropriate for a 35-year-old may be meaningfully insufficient for someone at 65. This information belongs to you. It always did, and now you have it. Beyond the research and the data, I simply want you to be well. I want you to have the kind of mornings where your energy reflects what your body is actually receiving. I want your nervous system to have the raw material it needs to maintain itself. I want your brain to have the biochemical environment it requires to stay sharp and clear. Research has definitely confirmed that a deficiency in this essential vitamin is harmful to the body and the brain, with worse deficiencies generally causing greater harm. That is the core truth this investigation exists to communicate. Share this with someone who deserves to know what you now know: a spouse, a sibling, an aging parent, a friend who mentions being tired all the time and cannot explain why. And stay with us, because the next investigation is already underway.